Welcome to our presentation on email collection in the Diabetes Education and Support Clinic, presented by Kate, Linda, Miriam, and Sarah. Today we will be discussing our findings from the case study for email collection at hospital.com, the data analysis of email collection errors at Sir Email Immaculate Hospital, and our solution proposal for managing email collection errors by addressing the human process and technical solutions. Lastly, we will be summarizing our conclusions. We would like to review the case study for email collection in the Diabetes Education and Support Clinic. We were tasked to assist Jagmeet to understand the implications of collecting patient email addresses as part of his portfolio in an outpatient diabetes education and support clinic. Jagmeet learned that a majority of the patients coming to HDC's diabetes clinic wanted to communicate via email. Data collected during the registration process can vary across departments within the hospital. Examples of demographic information are full name, email address. Examples of a care provider is the patient's primary care physician. Relevant clinical data could be falls risk questions and allergies. Insurance and payment information examples could be provincial health card number and private insurance. Other data that might be collected during registration could be consent to communication and emergency contact. Collection of patient information, inclusive of the patient's email addresses, is a procedure completed upon the patient's initial visit to a medical facility. It is updated each time the patient presents for care and flows across many different encounters throughout the patient's lifetime. This information is utilized across both the clinical and administrative components of the health information system. Unfortunately, as long as a company employs people, there is the potential for human error, such as homophone errors. For example, the spelling of Samuel White's last name, W-H-I-T-E, instead of W-H-Y-T-E. As a result, it is extremely important to ensure all data collected is accurate and complete. To eliminate some of these errors, email addresses can be verified by having the patient complete a consent form on an electronic device such as a tablet. Once enrolled for electronic communication, a verification code or link can be sent to the email address provided. Correcting an email address can easily be done by clerical staff via the patient management system. The solution is more complex when electronic communication is unsuccessful or sent to the wrong recipient. If the sender receives the notification that their message was not sent, the patient must be contacted to update their email address. If sent to the wrong recipient, this is considered a privacy breach. Let's walk through how to manage a privacy breach according to the Information and Privacy Commissioner of Ontario, or IPC. First, notify relevant staff, including the Privacy Office and IPC if needed. Next, identify the scope of the breach and contain it. Then notify those affected. Conduct an investigation and add to the privacy breach tracking tool used for reporting to IPC. When communicating patient information through email, there are significant risks associated to the organization, such as a loss of trust and confidence in the entire health sector. As a result, organizations have an obligation to protect PHI, according to Ontario's Personal Health Information Protection Act. Another potential issue is the increased risk for malicious viruses. These viruses could trigger large-scale privacy breaches or disrupt vital computer systems. The use of secure email messaging is gaining popularity in healthcare. Benefits for the patient include quicker access to laboratory results, improved appointment management, and streamlining the process for medication refills. On the contrary, there are also risks, such as a patient's privacy being compromised. Another issue that may arise from inaccurate email collection is delayed treatments. An incorrect email address could also lead to the lack of a timely response for follow-up or delay the communication of time-sensitive results. We have devised the following problem statement to improve email collection at registration. The target of Hospital.com HDC is to incorporate email collection into the registration process at the Diabetes Education and Support Clinic with 90% accuracy within 1 year of implementation. Using data from SEIH, the following 4 graphical representations were created to help the team make informed decisions regarding what factors contribute the most to invalid email collection. According to the data provided by SEIH, a total of 354 emails were captured incorrectly in 2018. April and December shared the lowest error rate at 22, whereas June through August saw a substantial increase in errors, peaking at 42 in August. This increase is likely due to an influx of new staff as summer hirings occur, as well as the possibility of staff shortages due to summer vacations. A heavier workload can cause stress and lead to an influx of errors. SEIH collects email addresses from 6 different sources. Errors most commonly occur on referrals from the community. This source is unique in that it relies on information collected outside of the hospital. As a result, it may be beneficial to ensure a process for verification is in place prior to initiating electronic communication with the patient. Investigating staff processes and work environment may also help to identify where support is needed to facilitate fewer errors. This chart lists the 7 ways incorrect emails are detected, with the most common method being an email delivery failure notification from the Internet service provider. Although an incorrect email address may not be the only reason for the error, this is still an indication that the email was undeliverable. Fortunately, these notifications are returned promptly to the sender, so action can be taken immediately. According to the Pareto principle, 80% of results will come from just 20% of the action. In the Pareto chart pictured, 20% is represented by the following 2 causes. The patient provided an incorrect email address, and there was a typographic error. For an email collection initiative to be successful, HDC will have to devise smart solutions that successfully address the top causes of email collection errors. Now we would like to move on to our proposed solutions to managing email collection errors. Review of the data from SEIH determined that errors on referral forms from the community accounted for 36% of all email collection errors. So electronic communication should only commence once the patient has presented in person. Clinic staff should also be comfortable confirming demographic information, either verbally, read back to the patient, or visually, having the patient review it. This solution falls under the psychological level of the human tech ladder, which states that technologies must fit well within the cognitive abilities of people. Another human process solution would be to introduce a mandatory learning module for all staff. Focusing on staff education will address timing of errors, errors specific to capture method, and cause of errors. At SEIH, email collection errors peak at 42 in August when new staff are hired and seasoned staff are on vacation. We also notice that 27% of errors occur in person during registration, and 29% of errors are typographic. How would this minimize errors? Introducing a mandatory learning module that reviews privacy legislation, email collection policies, and correct technique would educate new employees and improve performance of existing staff. At the psychological level, the development team will need to ensure that content is concise, relevant, and easily located. At the physical level, they need to ensure visual elements such as size or color of text and delivery method can be adapted to suit the learner's needs. A technical solution could be an additional alert notification. The data received from SEIH showed 21% of errors occurred during registration at self-serve kiosks. By adding additional alerts, the patient will be prompted to ensure their information is correct. Having a dialog box built into the HIS to confirm email at time of collection falls under the organizational level on the Human Tech ladder, as this is implementing a standard practice across the organization. Another technical solution would be an integration of text or email message verification codes. A report published by Verizon in 2018 revealed that the healthcare industry is nearly 7 times more likely to have an error causing data breaches than any other industry. A technical solution to resolve the issue of potential typographical errors is to send a verification code to the patient with a link to verify the correct email address was provided. This would minimize any potential risk of a privacy breach, as no PHI will be communicated electronically until verification is received. This solution takes into consideration the political and psychological levels of the Human Tech ladder, as privacy law and systems integration are involved. In conclusion, further research is needed to facilitate the implementation of a comprehensive and secure email collection policy at HDC. Depending on the type of errors, as well as when and where they occur, HDC may need to carry out further training and consider additional system security updates before the implementation of email collection is initiated in the diabetes clinic. According to SCIH data, typographic errors and incorrect emails provided by patients cause almost 70% of all email collection errors. These regularly occur in person at registration or when transcribed from community referral forms. Addressing these key issues should result in fewer delays for the patient and decrease the risk of information being breached. Finally, we were able to develop 4 comprehensive solutions using human factors engineering that would ensure success in achieving the clinic's objective of incorporating email collection into the registration process with 90% accuracy within 1 year of implementation. Thank you for watching.